Hi guys, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today we have a special guest, Kelly Herbert, who is our COO of our practice. And Kelly's going to be asking me some questions, some candid questions and answers, hopefully.
Yeah, thanks for the warm welcome. And today we're going to be talking about what it's like from your consultation until you achieve your final results. So I'm just going to jump right in with questions. Dr. Ladner, when we have patients come in for consultations, one of the first things they ask before even what do I need and how does that work is how long until I'm fully healed? So what does healed even mean? And what do final results mean?
Yeah. So I think people have different perceptions of what healing really means. And so I make sure that we're on the same page when we're talking about healing. So does healing mean when can they get back out into public? Does it mean when can they get back to their job? And we're going to go through
when can I exercise?
When can I exercise? Yeah. That's right. And so we're going to go through all of those ranges, right? I tell folks that first week, you're going to be devoting a lot of time to the care to optimize the results. The second week, you're going to be feeling a little bit more energetic than you did in that first week. Typically by 14 days, you're able to do daily errands, able to report to your job. Important events or semi-important events like going to a nice dinner, I tell folks it's usually going to be about 3 weeks depending on the procedure.
Okay.
And then, really important events, it can take 6 weeks to feel like you're, kind of at that confidence level of attending an important event. But healing really can take on lots of, I think different dimensions. And so I always kind of go through the long-term healing too, which is when are the incisions going to truly look their best? And in some folks, it could take as long as 4 to 6 months to get to that final stage of healing.
Great. So when someone is ready to start their journey, they've done some research, they've decided they want to meet with you, how soon should they have that consultation prior to that event or when they're planning to have surgery, right? So if I want to have surgery in June, when should I come in for that consultation? I know you sometimes do book pretty far out, but in general, they're not having surgery the week after they come in for their consultation, right?
Yeah, that's right. So, I think it's a sweet spot where you don't want too much time to elapse from the day of the consultation to the surgery, just because you will have forgotten a lot of the information that I'm reviewing. And, at least I biasly think that that information is very important. Because it really kind of sets those expectations for what they need to be doing before and after the surgery. But in general, if someone's calling for a consult, it's going to be probably 6 to 8 weeks to get them in for the consult. And then after they've gotten in for the consultation, it's typically going to be somewhere between 2 and 4 months to actually complete that surgery. And some of that's going to be seasonal. There are busier times of the year, of course, for some of these procedures. Winter tends to be a very, very busy time as a heavy facelift surgeon. Do lots of facelifts, that tends to be a time that people want to recover and recuperate from their facelift.
That makes sense. Okay, well, let's talk about that recovery and recuperation. So weeks 1 through 4, give me like a week by week from a facelift. We'll start with a facelift. What does that recovery look like? I know in the first week you still have sutures and your head's all wrapped up. It can be a little uncomfortable. You might look a little crazy.
Yep. Yeah. So I think that first week it is imperative that our patients have really good support. And so that could either be with our concierge nurses, it could be with a spouse that truly is a attentive caregiver. It could be with a friend, but having that support, having someone that's going to be able to kind of keep them on track to optimize the healing, that first week is so important because really it's more tedious. Most of these procedures are not overly painful, but you don't necessarily feel like yourself. And with any level of anesthesia or just the experience of going through surgery, there's a little bit of sort of a down, for every upper, there's a downer. I think that first week can be emotionally kind of a roller coaster.
Okay.
And then at 7 to 14 days, I think that's actually the week that folks make the most amount of progress in terms of their healing. They start feeling a little bit more energetic. They start looking more like themselves because the swelling is going down quite a bit in that second week. And that's when they kind of start seeing the light at the end of the tunnel. And then typically by 14 days, again, that's when they're able, to go to the grocery store, just do some daily tasks, maybe go to work, with or without telling their colleagues, that they had something done. Yeah. I feel like at a month is when folks kind of move on from the surgery in a lot of ways. and they're not constantly thinking about it. They're not having to do as much to care for those incisions, to care where we've done the procedures. And I think that they're just kind of getting back into normalcy at about a month. And then, as I stated earlier, 6 weeks for those really important events, things like weddings, anniversaries, reunions, et cetera, et cetera.
But so you're saying in that first month, it's really a roller coaster throughout that first month. You might have had more salt in your
That's
diet,
right.
a few weeks in, and you wake up and you're all of a sudden you feel swollen and puffy again, and you're like, oh, is this a complication? No, it's the French fries from last night, right? But patients don't always know that if they're not a surgeon and understand what to expect in the roller coaster. So I've heard you tell patients, just trust the process, right? If something doesn't seem right or feel right, immediately call our office,
Yeah.
let my clinic nurse or myself talk to them.
Yep.
But other than that, like, trust the process. If you feel okay, you might not look the same from day to day, but that it will even out and smooth out over time. And you're saying kind of that month is that threshold. But then what about the final result? Like, what everybody talks about, the final result. Is that 6 months? Is that a year? Like, when can someone expect to hop off of that roller coaster?
Yeah, so for the majority of our patients, we're going to see our patients for the first 6 months. And I think you hit the nail on the head. Typically at 6 months, that's when the incisions are looking great. They can look great well before that for sure. But some people will tend to have a little bit of peatiness, which is a normal reaction to those dissolvable stitches that we put underneath the skin. And so they're breaking them down, so that creates normal inflammation, and that leads to peatiness. Some people don't get as much of that. But at 6 months is a pretty reasonable time when folks can say, okay, my incisions are looking awesome. All my swelling is gone. They're well beyond obviously the bruising, which is going to be the first 2 to 3 weeks. They're back to normal workout routines. So 6 months is definitely, I think, even a little bit, I think it's preparing them for the worst. And most folks are going to be well recovered before then, but that's a reasonable timeline.
Okay, well, I think that's all the questions I've got today. Thank you so
Great.
much for
Thanks for
being
being
such a
here.
good sport. Yeah.
And if you guys liked what you heard today, please be sure to like the video and subscribe to our channel.